History has been made, and if you're somebody that's interested in healthcare, Medicare benefits, you're going to want to watch this video all the way through. Now, I've got video footage and articles you are not going to want to miss. And take a look at the headlines rolling out, you guys. You love to see it. Medicare for All sees a record support. And we are hearing over 120 representatives have co-sponsored this bill to give Medicare benefits to everybody. Now, this is just coming out in the past couple days. Take a look. Senator Bernie Sanders renews the push for Medicare for All to end totally broken healthcare system. Updates rolling out on this. High healthcare costs can lead to financial strain for many individuals and families. Senator Bernie Sanders is pushing to change that with a Medicare for All, and we're hearing that there is massive, record new historic support for this in 2023. And I've got the video footage as he's announced we have got to reform this totally broken system that leaves so many people that depend on these benefits behind and in financial ruin. And take a look, Pramila Jayapal's page. Jayapal, Dingell, Sanders introduce Medicare for All Act of 2023. Now, I'm going to give you all the details on this, but there is a new renewed push to get this through Congress, and it is massive. And let me know your thoughts. Should we have Medicare for All? Bernie Sanders is saying 100% yes, and he's saying it's a travesty that we do not already have it as one of the world's largest forces, nations, that does not have this in place. So let's go ahead and get into the details. And also, as you guys know, right now, we are in the middle of debt ceiling negotiations. We have about a week left before we potentially could default. And we're hearing that this could devastate a lot of programs that people depend on around the nation. And there's a new bill that was just released. Stick around to the end for an update on this, where they're saying cut Congress's pay, do not give them back pay. They do not get their salaries if they do not perform for the American people. And I normally do not share my opinions here on the channel. I just report the news, but I'm going to let you know on this one, I 100% agree. Don't give them a paycheck if they don't deliver for the American people. Let me know your thoughts. Maybe I'm too harsh. And I've got a segment from Bernie Sanders that's about 12 minutes long, but he dives deep into what he wants to see for healthcare. Before we dive into all of that, do me a quick favor, smash the like button. If you appreciate the content, subscribe to stay up to date. It's totally free. Why not? I'll let you know everything happening with Congress, the economy, stimulus, Social Security, Medicare, anything that could help you and your family. But with that being said, you guys, let's go ahead and dive right in. So we're going to look at the video footage of Bernie Sanders here in just a second. But first, let's take a look at this article that just came out with some context a couple days ago from CNBC. And it says, for many Americans, a medical emergency can lead to a financial crisis due to the high costs of healthcare in the United States. This week, Senator Bernie Sanders is renewing his push for a new approach, Medicare for All, that he touted as a presidential candidate. The current healthcare system in the United States is totally broken, he said, and you're going to hear it in this video footage in just a second. It is totally dysfunctional, and it is extremely cruel. With the support of the Democratic Representative Pramila Jayapal of Washington and Debbie Dingell of Michigan, the lawmakers, they plan to reintroduce a bill titled Medicare for All Act of 2023 in both the House and the Senate on Wednesday. Now, in the House, the proposal will have 112 co-sponsors, more than they have ever had at an introduction of a bill. So this is a historic amount of support and push for this Medicare for All bill. Jayapal noted, despite having fewer Democratic seats than in the previous Congress, Medicare for All would create a single-payer program which would allow one source to collect all healthcare fees and pay all healthcare costs. It is long overdue for us to end the international embarrassment of the United States being the only major country on earth that does not guarantee healthcare to all of its people, Sanders said. Now is the time for Medicare for All, single-payer program. Wow. Let me know your thoughts in the comments down below. And it also says that research shows that Americans suffer under the burden of high healthcare costs. Almost 1 in 10 adults, or approximately 23 million people, owe medical debt, to the tune of 11 million people owing $2,000, 3 million people owing more than $10,000. And they're saying that this would help out literally millions of people around the nation. Universal Medicare for All. Now, I think a lot of people think that sounds nice, but what is the cost? And that is mentioned in this article, and it is a hefty cost. Take a look at this. One of the key obstacles of implementing Medicare for All would be the cost. And it says that it is estimated estimated that the plan would cost somewhere between $32.6 trillion to $38.8 trillion over the course of the next 10 years, or in other words, roughly about $3 trillion per year. Keep in mind that right now our nation's total debt is around $31.4 trillion. So we would essentially double our debt over the course of the next 10 years. So it is a pretty hefty price tag to pay. So that is probably the biggest obstacle to get past. And right now, with the way inflation is, that's going to be a hard pill to swallow. Let me know your thoughts. Let's go ahead and take a look at the video footage of what Senator Bernie Sanders had to say.
But before I introduce the panelists, I just wanted to make a few points. Number one, the current healthcare system in the United States is totally broken. It is totally dysfunctional, and it is extremely cruel. We can no longer tolerate a system which spends $13,000 for every man, woman, and child, twice as much per capita as do the people of any other major country. We cannot continue a system in which, despite all of that spending, 85 million Americans are uninsured or underinsured, and you guys see them every day walking into your offices, where 1 out of 4 Americans cannot afford the prescription drugs their doctors prescribe. And what the system does not talk about, over 60,000 Americans die every single year because by the time they walk into the doctor's office, it's too late. What an outrage. We cannot continue a system in which our life expectancy, how long we live, is lower than almost every other major country, and above and beyond COVID, which certainly was a disaster for this country. Above and beyond that, our life expectancy is actually declining. And in this healthcare system, working class and lower income Americans die 10 years earlier than wealthy Americans. Can you believe that? So poverty is a death sentence. Whether you have access to decent healthcare, you live or you die. We cannot continue a system in which large parts of our nation are medically underserved, medical deserts, where rural hospitals are being shut down, and where people, even with decent insurance, have to travel hours in order to find a doctor. This is America, traveling hours to find a doctor. We cannot continue a system in which, in the midst of a major mental health crisis, Americans are unable to find the affordable mental health treatment they need. We get calls all of the time in my office. I suspect every senator does. Senator, we've got a crisis, my husband, my wife, I can't find the kind of mental health counseling I need. Can't afford it. We cannot continue a system where millions of senior citizens have no teeth in their mouths, cannot afford dentures, they can't afford the hearing aids they need, or the eyeglasses they need. And this is after spending twice as much as any other major country on earth. We cannot continue a system where, despite all of our expenditures, we don't have enough doctors, we don't have enough nurses, we don't have enough dentists, we don't have enough mental health professionals, we don't have enough pharmacists and other healthcare professionals. We cannot continue a system in where we spend less than half of what other countries spend on primary health care, the means by which we keep people healthy and out of the emergency room and out of hospital. We cannot continue a system in which, while we are in desperate need of more healthcare professionals, young people are graduating medical school, dental school, and nursing school hundreds of thousands of dollars in debt. I mean, how insane is that? Desperately need doctors and nurses. Say, good, you want to go to medical school? You want to go to nursing school? Good, you're going to come out deeply in debt. We can't continue a system in which Black and Latino and Native American doctors and nurses are grossly underrepresented as medical professionals. I was just at Morehouse University Medical School last week and talking to the folks there. About 12–13% of our population is Black, 5% of our doctors are Black. Same thing with nurses, same thing with Latinos. We cannot continue a system where doctors and nurses spend half of their lives arguing with insurance companies as to the kind of care they should provide. Doctors and nurses should make those decisions, not insurance company bureaucrats. And we can't continue a system where patients have to fight their way through a complicated system of premiums, deductibles, co-payments, networks, and Byzantine forms as to what kind of treatment they should get. We cannot continue a system in which health care is attached to your job. Think about how crazy it is that during the pandemic, millions of people lost their jobs. That's pretty bad. And on top of that, because their health care is attached to their jobs, they lost their health care as well in the middle of a pandemic. It is totally absurd that the quality of care an American receives in this country is dependent upon the generosity of your employer or whether you have a union. Workers at McDonald's deserve the same quality care as executives on Wall Street. Let me be as clear as I can be. The function of a rational and humane healthcare system is to provide quality care for all as a human right. It is not to make tens of billions of dollars every year for the insurance companies and the drug companies. So yes, it is long overdue for us to end the international embarrassment of the United States being the only major country on earth that does not guarantee health care to all of its people. Now is the time for a Medicare for all single-payer program. And let me be very clear, and I say this here in the halls of Congress. The debate over health care and over Medicare for all has nothing to do with health care, because the current system cannot be defended, and in fact, it very rarely is defended. You don't have too many people getting up there on TV saying, oh, man, we got a great system. That doesn't happen. What the debate over health care in this country is really about is the extraordinary greed of the healthcare industry and their desire to maintain a system in which they make huge profits every year. That is what we're really talking about. While ordinary Americans struggle to pay for health care right now, the health insurance companies in our country made over $69 billion in profit last year. Think about it. People can't go to a doctor, they don't have any insurance, they're dying, they're getting sick. Insurance companies make $69 billion in profits last year. Pharmaceutical industry last year, the top pharmaceutical companies made over $112 billion in profit. And their CEOs make unbelievable compensation packages. So in other words, the healthcare system is doing just great for the people who own the system, but it is failing ordinary Americans. Let's also be very clear in terms of what we are taking on. In order to defeat the Medicare for All movement, these powerful special interests have spent tens of millions of dollars on 30-second TV ads, full-page magazine ads, and corporate-sponsored studies to frighten the American people about Medicare for All. And by the way, that's exactly what happened in the 1960s when Congress passed Medicare. You'll remember, or you've read about, socialized. Medicare was socialism. Today, of course, Medicare is the most popular health care program in the country. So what we're looking at is an industry that has spent billions of dollars on lobbying, campaign contributions. Right now, as we speak, this moment, right here on Capitol Hill, the pharmaceutical industry has over 1,800 well-paid lobbyists. 1,800. There are only 535 members of Congress. I got 3 lobbyists for every member of Congress. Former leaders of the Republican Party, the Democratic Party, are swarming all over this place. So where we are today is not complicated. The American people understand this system is failing. The American people understand that health care is a human right. And our job is to bring our people to finally end a disastrous system and make it clear that every man, woman, and child in this country is entitled to health care because they are a human being.
So there you have it, you guys. Let me know your thoughts in the comments down below. Do you agree with Bernie Sanders, or do you think, no, this is going to be way too expensive? And also, they've got other things on the plate they're trying to deal with right now, like not having a U.S. default, which would cause a massive economic recession. Some are saying depression. There would be delays on a lot of benefits we're hearing about. And also, we're hearing people say, listen, if Congress doesn't do their job and they don't get this done, they should not get paid. There are too many people that are relying on these elected officials to get things done. And if we default, stop the pay to Congress. It's actually a new piece of legislation, a new bill that came out on this. And to get all the details on it, take a look right here. This is going to be introduced officially this week, and I will keep you guys up to date on everything so you know the latest. So check out that video next. Thank you guys so much for joining me. I'll keep you up to date on Medicare, Social Security, everything going on. But with that being said, take care. God bless. I'll catch you in the next one. This is Steve.